Hey guys, welcome to the video. So today I was going to talk about iliotibial band syndrome, or ITBS syndrome. It's something that we see pretty often. And so the presentation for it is typically somebody will come in with pain on the lateral side, the outside of their knee here. And what happens is it's really common with endurance athletes, so runners, cyclists. It can happen from repetition in the gym. It rarely happens from an acute episode. It's usually going to be something that they're doing on a repetitive nature, and over time things will start to break down and the injury will occur. So just some kind of basic anatomy here. So our IT band is a big fascial band that runs up here. The muscle component of it, it's called our TFL, or a tensor fascia lata. It's a small hip muscle in the front outside of our hip. And it shares some fibers with our glute muscle here. So they come down as a big triangle here. And then right as it goes below our hip, we have a big fascial band that tethers a little bit smaller and actually inserts inside of our knee capsule. So the injury itself is when that starts to get overworked, there becomes some friction on the attachment side, in the knee capsule. Some friction starts to develop and essentially inflammation and pain. So when we treat this, we really just got to kind of calm things down a little bit. So we got to restore some of that range of motion. When those tissues are overworked, rather than a nice smooth glide as they move, they start to scar up, especially within the connective tissue. So our treatment of choice in the office is active release. And if any of you guys have been to our office before, you know exactly what I'm talking about, because we pretty much use it with all of our patients to treat any soft tissue areas that need that attention. But that goes for the same with IT band issues as well. So we go right to town on it and get things to kind of calm down, lengthen, and restore range of motion there. We usually will end up seeing less pain, usually in a matter of just a couple visits. If it's a little bit worse, it might take a little bit more time, maybe 4 to 6 treatments for the pain to kind of settle down a little bit. But the most important thing to realize is when we get the pain to calm down, we're not really done. Our job's not really done there. And the work for the patient's not really done as well, because like I said, it's really more of a mechanical issue. It doesn't really happen from an acute injury. So we want to make sure that we're kind of peeling some layers back and figure out why they developed in the first place. So, we mentioned it's really common with runners. If you think about running, it's a repetition that you're doing, and every time you take that step, you're taking on about 2 to 3 times your body weight. And when you do it in a repeated fashion, then you got to be able to have the strength to be able to take on those loads. So one of a couple of the presentations that we see with our runners is when we do watch gait, we do see what we consider a collapsing gait. So essentially what that looks like is, in our mid stance, when we take most of our weight, we're not able to maintain our knee in line with our hip, and we start to collapse towards the middle here. We may not always see that knee come towards the middle. That's kind of your classic sign, but we might see a little bit of a dip in the pelvis too. And that's either way, both of those are showing us that they don't have enough strength to keep everything nice and stable here. And the one thing that often suffers is our T-band. So that is something that we want to address. Another common thing in gait we see is a weaving gait, where they almost look like they're running on a tightrope or a straight line. We see a lot of that crossover or weaving. That's something sometimes can cause some IT band issues as well. And then we also want to look at just overall volume of things too. Is this somebody who went from running very little and all of a sudden they decide to go out and run, 50 miles that next week? Or is it somebody who hasn't been in the gym for a long time and they decide to hit it really, really hard? So those are other things that we need to kind of peel back and figure out as well, to be able to kind of finalize how we're going to treat the overall issue. So, okay. So that's IT band syndrome. That's typically how we treat it. If you have questions, let us know. If this is something that you maybe you've been dealing with, we'd love to help you with it. But please feel free to send some comments and ask some questions, and we'd love to hear from you. But otherwise, we'll see you next time. Thanks.